Joint replacement surgeon Dr. Pawan is with us today. He is professor of orthopedics and joint replacement surgery in BJ's hospital. I will hand over the mic. He will give a brief introduction of how the joint replacement happens and what are the advantages of it, what are the types of the surgeries that people can afford to after 45 years if you have any that kind of an issue. Thank you, sir.
I'll just have a brief introduction to what the problem which people are going to have. I'll restrict my talk to the knee itself because knee is the most common joint which undergoes arthritis. So first we have to understand is arthritis can occur at any age, but the arthritis is basically the inflammation of the joints. So that can occur at any age. So the arthritis which we are worried is, or which universally occurs across the population, is the one which occurs after 45 years. That is called osteoarthritis. The arthritis which can occur at any age is usually an autoimmune disorder like rheumatoid arthritis or ankylosing spondylitis, where the management completely differs. But so the arthritis which occurs usually because of the age is can be treated optimally very well, and you can almost get back to normal life with the knee joint replacement surgery. So what exactly is happening in osteoarthritis? So as the age progresses, basically the metabolism in the body slows down. I mean, everybody can notice it slowly actually, but by the age of 14 or 16 you can eat 5 chapatis and still be not bothered about it. But as you reach around 35 to 40, eating 5 chapatis itself becomes a punishment for you within half an hour. So basically your metabolism is slowing down. So whatever dietary calcium or vitamin D3, whatever you are taking is not enough. So the bones start losing their strength. And as we advance in our age, physical activity also drastically reduces. We don't usually get up early, or our physical activity generally reduces because we try to optimize our time and we'll reduce the physical activity. So what happens is, bone is just like a muscle. If you don't work it or give sufficient work to it, it's going to lose its strength. So as the age progresses, your metabolism is coming down, so the dietary calcium, whatever you're taking is not sufficient, and your sedentary lifestyle makes the bone not loaded enough, so that the bone loses its strength. So the bone becomes weak. Once the bone becomes weak, the cartilage on which it lies, basically arthritis is the cartilage is getting destroyed. So the cartilage strength entirely depends upon the bone. If the basement is good, the cartilage is going to be good. So because of all these lifestyle modifications and the dietary modifications we have, the bone gets weakened. Once the bone gets weakened, the cartilage gets damaged. And once the cartilage damage occurs, it is not reversible. It doesn't heal on its own. So that damage is going to be there. Over that, our activities like Indian context, we sit on the floor, we use our Indian toilet, we have tendency to climb stairs. But after certain age, climbing these activities cause what is something called as a shearing force. So basically, they are rubbing each other. Once a minor damage is there in the cartilage and you start doing all these activities, the rubbing force is going to increase the damage. So you could have observed after 45-50, some people walk with a waddle or they try to move right and left. It's because once the cartilage is destroyed and the bone is weak, they start to bend. They usually bend inward. So the knee starts going outside and they have to balance. So once they start waddling, that is, they have to almost rock to and fro. So what happens? Their spines, they start having back pain. So everybody neglects that knee pain is very common, or they usually don't approach a doctor at a very early stage. But once it reaches the stage, it becomes very difficult for us to treat, because even though we correct the deformity in the knee joint, the back problem which has occurred because of the changes in the knee joint will not be easily reversible. So ideally they have to be addressed early with some physical exercises and tablets, and once it crosses that stage, the more earlier you get the surgery done, like a knee replacement. I'll come to the problems and fears of knee replacement later. But once we get it done earlier, the advantage is, one, your spine will not have undergone major modification because of the change in your gait or the way you're walking. So your spine doesn't need to accommodate too much of adjustment to the alignment of the body if you get it done early. I'm not telling get it 40 or something like that. If the disease or the arthritis has progressed significantly, there is no point in postponing it, because the more later you get it done, the results are not going to be good, because secondary changes, or because whatever the gait has altered, there will be secondary changes to the spine. So the results will not be so good and you will not feel happy about it. So that is one thing, to at least consult a doctor at the earliest, and then you can decide upon. Ultimately, nobody is going to force you to get any surgery done. That is one thing. Second, Knee replacements have been subjected to a lot of, fear about the results. So, usually by 40-45 there are so many comorbidities. Everybody will be having either diabetes or hypertension. Hypertension is a relatively safer comorbidity to have from my perspective as an orthopedician. But diabetes has certain long-term effects which are significantly affects our surgical outcome. Like they grossly involve the muscles. The muscle strength is inherently, it's like diabetes is a more dangerous disease which actually from inside it's going to destroy your strength. It affects your nerves, it affects your muscles, it affects your bones, everything. So a person with diabetes who undergoes knee replacements is required to have a good glycemic control. That means he has to follow the diet strictly and he has to take more lipoglycemics. There is no cure for diabetes. I mean, despite what other specialties or other modes of treatment say. So we have done replacement surgeries to diabetic patients who had like 200, 300 sugars, and then gradually after the surgery, they have reduced it with physical activity. Once the knee pain goes, your general physical activity is going to increase. So they can do more of walking, follow a good diet, and follow the advice of physicians for the control of sugar. So once they keep that in mind, usually they'll have good results. And secondly, the physiotherapy part, usually after the surgery they'll be in a lot of pain, at least for 3 weeks. But significant finding which was what we observe is, they'll tell that surgical pain is there, but even in that pain they can remember that the pain of arthritis is not there. So it's almost like instant relief will be there for that pain, but it takes time for the results to come. About 3 to 4 weeks is the ideal time, and it requires a lot of motivation from the patient himself or herself to get the exercise done despite of the pain. After the first 3 weeks, they will see drastic results. I think it's unfortunate, even our Chief Minister of Karnataka is not undergoing the surgery because of fear of pain. And he has a significant varus, and one knee is in varus, that means one knee is bent inside and the other knee has gone outside. And he is wearing all kinds of process. There are a lot of fake treatments, stem cell therapy. I think there is a lot of marketing for stem cell therapy. Stem cell therapy has actually been found useless in US, and like any other technology, once it has been found redundant in US, they have started dumping in India. And then you have tablets like liposomal glycans and other things. I mean, diacetyl. There are some drugs which have been pushed by American companies into India once they have realized that it's not working there. So they do work to some extent, maybe at a very early stage. But as the disease has progressed, or you have some minor deformity, there is no point in postponing the surgery. Consult a doctor. I don't. You make a well-decided, well-judged decision for the surgery to undergo the surgery, but usually it will have a good outcome provided you are motivated enough to do some good physiotherapy. And if you are diabetic, you have to maintain a very good glycemic control after the surgery also. I mean, it's not like appendix surgery where you remove the appendix and then your problem is gone. So if you undergo knee replacement, you require to have a constant motivation to maintain it, because usually the life of knee replacement usually comes around 15 years. When I was working in Hyderabad, I was working under Dr. Rajesh. It is the second largest center in Southeast Asia which is doing knee replacements. So there I have seen knee replacement surgery which has served for more than 22 years. But the person was, when he came to us, he was around 82 years. It was done when he was 59. And he was non-diabetic and non-hypertensive. But primary thing was he was basically from village background and he was still physically active at 82. So it depends on how you do keep yourself active. So knee replacement, generally the fear is, oh, some relative has undergone and they are not doing good. And if you ask, I was asked so many people, show me the relative, I talk to them, they don't have that. Just that fear of something is going to happen, or something is there. But it's a wonderful surgery. Knee replacement surgery has been considered as one of the best orthopedic procedures because we don't add life to the years. So if somebody is going to stay for 75 years, you're not going to add another 5 years for his life. But whatever 75 years he is going to live, we're going to make it pain-free. This surgery, knee replacement, is basically to relieve your pain. So it requires some effort from your side, as well as our side also. So that unexplained fear of knee replacement should be thrown out. And unfortunately, we have a bad chief minister for as an example. I don't know. He walks, I mean, if anybody has observed, he actually walks very badly, and it looks bad. Like, so nobody has to go through that. Right? Just because of fear of knee replacement, he is not getting done. So that care should go. If any other this thing is there, madam is there, they can help you. So basically, walking, dietary modifications, and you need some good glycemic control for if you are diabetic to have a good result with knee replacement.
Thank you, Dr. Pawan. Any quick suggestions at the age of 45, at the age of 55, at the age of 65? What should be the practice?
Primarily, one is there was general idea that in tropical countries like ours, we have a lot of sun, and so usually Indians will not have vitamin D3 deficiency at all. So, but what recent studies have shown is around 70-75% of our population have gross vitamin D3 deficiency. So get your D3 level, unless vitamin D3 level is sufficient, bone strength won't be normal because calcium is often entirely depends upon vitamin D3. So first thing is whether your vitamin D3 is normal or not. If that is not there, get a supplementation for vitamin D3 and calcium. This is the dietary part. Second thing is physical activity. As I told earlier, as the age progresses, there will be some amount of changes in the cartilage. And the activities which are going to increase the cartilage damage are anything which causes the need to fold more than 90 degrees. Like squatting, or sitting cross-legged, or climbing stairs. What is basically happening is the cartilage surfaces are undergoing shear forces. Shear force is basically rubbing. So this rubbing happens beyond 90 degrees of flexion. So if you avoid activities like sitting on the floor, sitting cross-legs, using Indian toilets, usually these forces can be avoided, and the cartilage destruction progression can be slowed down. It can't be halted nor reversed, but it can be slowed down. And regular physical activity like walk on a flat surface, running even, but not on treadmill, on natural surface. Running on treadmill is supposed to cause more knee damage than running on a normal surface. And these activities usually preserve or postpone the development of osteoarthritis or progression of the osteoarthritis.
What about yoga?
Yeah, yoga specifically yoga is ideally for spine complaints, usually like Vrikshasana or Urdhasana and all those things. The primary primarily is for the spine. Knee, usually what happens is there's something called Vajrasana where you have to sit on the knee. Unless you have been doing it for a long time, and suddenly at 40-45 you start doing that. As I told earlier, anything you're folding more than 90 degrees, you're causing shearing forces across the cartilage. It's going to cause more damage. So Padmasana and Vajrasana should be avoided unless you've been doing from the age of like 12, 10, something like that. If you're starting late, better to avoid these specific asanas, and most of the coaches will be aware of those. Unless if you go to a good coach, they usually avoid 40-45 degrees, they avoid some yoga asanas. Because primarily is good for spine. For me, you have to be selective.
Even above 45 should not sit cross-legged, they should not bend 90 degrees.
Occasionally you can. Occasionally. Regularly. Yes, on a flat surface. The treadmill walking can be done, but running is supposed to cause high impact to the cartilage and it's going to cause destruction. So running is not recommended on treadmill, walking is fine. And walking on plain surface is highly recommended for osteoarthritis.
After 85, can it be done?
Yes.
85.
Yeah.
To tell you something, he has a record of operating on a 105-year-old patient with hip replacement. No sir, he walked on the second day. And our ward boys wanted to help him. He just said, no, I don't want to. Second day. Very nice. Achutara. In fact, we put that video in the YouTube also, and we requested the people to give a certificate, his PAN card and Aadhaar to confirm the age.
Justify the age.
Yeah, to justify the age, yeah.
The age is not a criteria primarily. Physiologically, what happens is we think generally if I have seen excellent bone at even at 90, 92. So basically, if your physical activity is good, and you have been keeping yourself active, usually the bone quality will be maintained, well preserved. But that we can do up to, there is no age limit, upper limit for the age. Probably the physiotherapy sessions which will require for post-operative rehabilitation is going to be more because all the muscles and other things might be not. We'll have to do a pre-operative evaluation, complete cardiac evaluation and all those things are there. And after that, we'll be able to explain the risks also. How much is the risk, all those things. So definitely risk will be there.
Is there any counseling for because after 85, parents will not be very much comfortable in coming to hospital itself.
Yes, sir, we
They
have.
avoid.
We have
That's what I'm saying, sir.
That's what I'm trying to tell. When, as a replacement surgeons, we don't add years to your life, but we add life to your years. Whatever years you have, you can be pain free.
Sir, any dietary recommendations?
Yeah, dietary recommendation primarily is anything which is rich in iron and calcium. Basically, greens. Increase the amount of greens which you have. Green leafy vegetables and greens. Then milk. Ideally, buffalo milk has the highest content of calcium. But procuring buffalo milk might be difficult. I mean, regular calcium is through milk only. Then you have jaggery. Jaggery is quite a good source of calcium and iron. And then you have ragi. Ragi is probably the best thing to add to your diet. These are the basic important, which have good calcium content in them. So, regular consumption of a glass of milk without any adding any sugar or anything like that. Green leafy vegetables, ragi and jaggery. Primarily, these are the 5 important things which usually we recommend. Just increase the content in the diet. And you, after the age of 40, 45, what dietary may not be sufficient. You will require some amount of supplementation through tablets or capsules. So because your metabolism is not, even though if you are consuming adequate amount of calcium, daily requirement of calcium is around 500 mg. So even if your diet has that 500 mg, your body will not be taking that entire 500 mg up into the system because you will need more quantity to get the targeted 500 mg. Because the absorption and everything would have. That's the reason why as we age, people tend to gain weight. So we need to supplement sometimes. But these are generally dietary the thing which you have to do. Yeah, better. But
After 45 years, especially for ladies, prophylactic calcium.
Yes. Now our recommendations come from the European Union, which says there is something called a concept of bone stock. So they say you start calcium supplementation at the age of 30 for females because they have a protective, they have something called as estrogen. I mean, male and man, every man and woman will have estrogen to some extent, but women have much more. So that estrogen has a protective property over the bone quality. But by the time they are reaching 40-42, the estrogen level significantly drops and that protection is suddenly taken off. So they are telling that at the age of 30 you have to start supplementation. I mean, for us, in Indian population, if you tell that you have to take calcium tablets at the age of 30, they'll probably laugh at us. So we have not accepted that concept. But it's very clear that the more earlier you start calcium supplementation and you have good bone stock, you can postpone your arthritis and other problems related to the bone. Around 40, I think it's almost mandatory for every woman to take a calcium supplementation.
Sandeep, you have any?
No. Well explained. No, I'm good. No, sir. I'm good. Well, prayer adagalla. Doctor.
Naveen sir.
Adagalla.
Mic.
Cycling, you have to ask your wife.
No, doctor, he's a doctor. What about cycling, sir?
Yeah, cycling. You can do static cycling also you can do. Static cycling also you do. Natural cycling also you can do. But provided you don't have any back problems.
No.
Okay.
He cycles 100 kilometers.
There are some drawbacks of the cycling. But since it's a family crowd, I don't want to.
I'm between bus.
Yeah.
Sir, one clarification.
Yeah.
Adding sugar to the milk content along with coffee powder, whether it reduces the calcium content in the milk?
No, it doesn't reduce that. So, I mean, I don't want to do dramatic. In olden age, I mean, sugar was a luxury, I guess. And
Medical
sugar was
field,
prepared
right.
only for the festivals. So, I mean, sugar is one of the poisons which gets in every house. Carbohydrate. So, anyway, for that reason I told don't add any sugar to the milk.
But it doesn't reduce the
No,
calcium.
it doesn't interfere with it. But any company, I don't want to market any company. Over the counter, whichever is available near your pharmacy, provided it's a standard company. There are a lot of local companies which you better avoid because the calcium content is not standardized. international or national companies involved. Promote this particular company.
So you said supplement two tablets also is.
Yes. Whatever dietary calcium you're taking will not be completely absorbed by the body. So you have to increase the calcium content in your diet. Sometimes we might not able. Green leafy vegetables, I'm suggesting you to take it more. But we don't know the nutritional value of the green leafy vegetable. It's available for you in the market. We don't know where it's grown. Like ideally it has, but that itself might not be sufficient. So we try to supplement with the calcium tablet.
I heard that Menthia soup is the best for cancer.
I think best to avoid palak because it has a tendency to form stones in your kidneys. So apart from palak, any other greens is fine.